right, guys, I'm here with Miss Kathy. She's going to be explaining to me what I need to do to get ready for chemotherapy. She has some educational stuff, so she's going to do most of the talking today, so I'm going to let her speak. I believe she said she didn't want to be seen visually. You said, right?
Yes.
Okay, so you'll be hearing her. So you get to look at my lovely
you
face
can
when
imagine.
she talks to
No,
me.
I'm just kidding.
All right.
So this is a sheet for you to take home. This is a general education form we give to all our patients. It has her medical record number, her date of birth, today's date of service on it. You'll see the first statement says that we're going to talk about 2 drugs today, adriamycin and cyclophosphamide. We're going to go over each drug separately and the possible side effects. I've given you a handout. It's right behind this sheet, and you can read it when you get home. It's just an overview of breast cancer, and it comes from this website, cancer.net.
Oh, then I probably read it because I've been on their
You
website.
Probably, yeah, it's a good website. And you'll see I checked down at the bottom there, go to cancer.org. That's another good one for reputable information that you know is going to be reliable. Now let's go to this next statement over here. You are getting what we call adjuvant chemotherapy. And that means basically you've had the lumpectomy, everything is good. We are just giving you treatment to make sure there's no rogue cancer cell floating around in your body that we can't see or didn't pick up. Okay, it's a seek and destroy mission to make sure we get every single thing we can get. Okay, that's the best way for me to explain that. Now, how you're going to get treatment is you're going to get AC, which is the adriamycin and cyclophosphamide, every 14 days, okay, for 4 cycles. So we're going to come every 2 weeks, and we're going to do that 4 times. After you come for your first treatment, let's just say your first treatment was tomorrow. You would get treatment tomorrow. The next day, you're going to have to come back to the office, and you're going to have to get a shot. It's called Neulasta. Neulasta is given so that it boosts your white blood cells up, and it keeps your white blood cells okay and on target so your treatment can stay every 2 weeks. We don't have any treatment delays, okay? So for you, that's going to happen 4 times. Treatment, next day shot. 2 weeks later, treatment, next day shot. We're going to do that 4 times. That's the first part of your chemotherapy. The second part of your chemotherapy, we'll meet again like this and talk about the next drug, which is going to be Taxol. If we do it all together, it just gets overwhelming. Come in.
Kathy, I'm sorry. I just need to speak with you one quick second.
Excuse me
That's
just a second, okay?
Okay, so we're going over what she said on the first page about what the name of my medicines are and how often I'm going to have to take them. And with me today is my lovely mommy. Hey, Mom. I caught her off guard. Okay, so she explained the name of the medicine, and no, I can't pronounce it. At least not yet. I'm going to need to practice that. But I have to take it 14 days for 4 cycles, and then Neulasta after each treatment. So it's really a 2-day process because I have to do the chemo one day and then get the shot the next day. And then kind of do that in a 14-day increment from what I believe she said. So as soon as she gets back in, because she had to go out because somebody was calling her for something, she's going to go over some more details about my chemotherapy. But she did give me several pages of stuff to look at. Most of the stuff is on the website, cancer.net, if you're interested in learning more about chemotherapy, side effects, kind of medication, because chemotherapy is not all the same. So she just kind of go over what kind of mixture I have and how it's going to affect me. And that's something she's going to talk about when she comes back in.
All right, thanks. Sorry about that. All right. So we'll finish this sheet. Did you understand the treatment, how the treatment's going to go? Okay, so that's part 1 is the adriamycin and cytoxin. We'll meet again before we do part 2. If we do it all together, it does get overwhelming. It's a lot of information. I am going to give you handouts. You have them here in your stack. Some home care instructions, and that's basically when do you need to call us after treatment. Okay, it's kind of the short list of if this happens, call. If this happens, call. The bowel program, we'll have a handout on that, and we'll go over that, and the infusion room guidelines. The infusion room is the name for the chemo area out here. Some guidelines for that, and we'll go over those as well. Okay, so you have all that to take home. So if you want to put this to the side, and then right behind it, you've got the overview of breast cancer. You can put that to the side as well. Okay. And then we'll talk about the first drug we have. Should be probably about the 3rd or 4th page in there, Mom. Yep, keep going. Yep, you got it right here. Should be
That's it?
Yep.
Okay.
Okay. So, see, I have exactly what you have. Yours goes home and we just sign mine. All right. And you'll see there's a place for you to sign. It has your name, and a place for me to sign. It has my name. Okay. So doxorubicin is the generic name for adriamycin. All our drugs have more than one name, and they're all, frankly, kind of strange names. Okay. So doxorubicin is adriamycin. It treats cancer, and you'll see adriamycin listed there under the brand names. So when should this medicine not be used? This medicine is not right for everyone. You should not receive this medicine if you had an allergic reaction to doxorubicin, if you are pregnant, or have had a recent heart attack. How to use this medicine? It's an injectable. Okay, so we're going to use your port. When you come for treatment, all your blood is drawn peripherally. Okay, you'll see the lab girl. She'll draw your blood. Then once you get back to the chemo area, they'll access your port, and everything we give you will go through the port. Okay, so it's basically one stick once you get back to the chemo area, and they'll use that the rest of the day. Okay. Medicines used to treat cancer are very strong. They can have many side effects. So before receiving this medicine, make sure you understand all the risks and benefits. It's important for you to work closely with your doctor during your treatment. Your doctor will prescribe your dose, how much medicine you're getting, and your schedule. We already know for her it's going to be every 14 days. Okay. This medicine is given through a needle placed in a vein. That's your port. You will receive this medicine while you're in a hospital or here in our cancer treatment center. A nurse or other trained health professional will give you this medicine. The medicine is usually given once every 21 to 28 days, but for her type of cancer, we do give it every 14 days. Okay. Do not get the medicine on your skin. If it gets on your skin, wash the area well with soap and water and tell your caregiver. Again, when we use ports, usually doesn't happen. Sometimes we give this medicine, we give it peripherally, and that tends to be a higher risk if we do that. Most people don't have any issues when we use a port. Okay. If you feel stinging or burning in your skin where the needle is placed, tell your caregiver right away. Apply ice to the skin for 15 minutes, 4 times each day to relieve pain or swelling, and do this for 3 days. Tell your doctor if you have blisters, sores, or other skin changes where the needle was placed. Drink extra fluids so you will urinate more often to help prevent kidney problems. We like all our chemo patients to drink a lot of water. Okay, just to flush everything out. Okay. Read and follow the patient instructions that come with this medicine, and talk to your doctor or pharmacist if you have any questions. The medicine needs to be given on a fixed schedule. So for you, that's every 2 weeks. So if you miss a dose, call your doctor, your home health caregiver, or treatment clinic for instructions. Sometimes things happen. You know, the car breaks down, or life gets in the way, or you're sick. So if you know you're not going to be able to come for treatment, call us and we'll get you rescheduled right away to keep you as on track as possible. Okay. Drugs and foods to avoid. This says to ask your doctor or pharmacist before using any other medicine, including over-the-counter medicines, vitamins, and herbal products. Now, do you take any medicine every day?
Yes. The high blood pressure medicine and my allergy medicine.
Okay.
And then I was taking a multivitamin and magnesium.
Okay. And those will be fine.
Okay.
Okay. Over-the-counter vitamins, just a multivitamin, multi-mineral supplement are usually fine. The blood pressure medicine is fine. The allergy medicine is fine. If you're not feeling well, you can take over-the-counter Tylenol. We have people that take Motrin occasionally if they need that, or Aleve. That's fine too. Usually if you have a cough or cold, you can take some over-the-counter cough, cold medicine. If it gets kind of out of those range of those few things, you're not sure, just call and ask, and we'll be glad to guide you through that. Okay. Now you'll see a list here. It says some foods and medicines can affect how doxorubicin works. So tell your doctor if you are also using any of the following: St. John's wort, that's an over-the-counter supplement. Mercaptopurine, cyclophosphamide, paclitaxel, or trastuzumab, phenobarbital or phenytoin, those are seizure medicines, or something called verapamil. You're not on any of those. And you'll see that there are no foods on that list. Okay. Warnings while using this medicine. This medicine may cause birth defects if either partner is using it during conception or pregnancy. Tell your doctor right away if you or your partner becomes pregnant. Use an effective form of birth control during treatment and for 6 months after the last dose of this medicine. Tell your doctor if you are breastfeeding, or if you have liver disease, heart disease, or blood or bone marrow problems. That's known as myelosuppression. Tell your doctor if you have received other cancer medicine or radiation treatment. This medicine may cause the following problems. Again, it doesn't mean it will, but it's possible, okay? Heart damage, including heart failure that may be permanent. That's one of the reasons we check your heart before we start, okay? It could cause a heart rhythm problem, a higher risk of new cancers, skin damage near the injection site. Again, we're using the port, so that's not common. or something called tumor lysis syndrome. Tumor lysis syndrome is more common in other types of cancers that we use this drug for. Okay, it's not common in breast cancer. This medicine could cause infertility, so talk with your doctor before using this medicine if you plan to have children. This medicine may also cause premature menopause. This medicine may make you bleed, bruise, or get infections more easily. So take precautions to prevent illness and injury and wash your hands often. Now, both drugs are going to say that it may make you bleed, bruise, or get infections more easily. And that's just because any chemotherapy we give you can affect your blood counts, your white blood cell count, your hemoglobin, your platelet count, okay? But every time she comes for treatment, she's going to get checked, okay? So anytime you come for treatment, the procedure is going to be go to the lab, get your labs drawn. About 45 minutes later, you're either going to see me or Dr. Manning. We're going to check you. How are you doing? How are you feeling? What side effects are you having? We're going to check her vital signs, blood pressure, things like that. Look at all that. And then we're going to look at her lab work. All those things have to be okay. And she has to go through all those little checkpoints before she ever gets to the chemo area. Okay? So you're never going to skip those steps.
So is that a separate day? Is that all in the same day?
All in the same day.
Okay.
Unless there is the option to get your lab work done the day before, as long as you don't have treatment on Monday. When we have treatment on Monday, we can't do lab on Sunday because we're not open. But you can come the day before if you live nearby. So, for instance, if you get treatment on Thursdays, you want to do your lab Wednesday afternoon and have that out of the way Wednesday afternoon, you can do that. And that's pretty easy. You just come, you have an appointment for your labs, let's say 3 o'clock, you come 3 o'clock, you get your labs, 10 minutes later, you're gone. And then we already know the next day. It saves you an hour on chemo day. Some people like that, some people don't. So that is up to you. If you want to do that, we can.
I guess I was thinking about like later on in the school year, for August, September, October area.
It might be beneficial for you.
How long it might take if I were to do it all in one day as opposed to just separating them into 2 days.
It's going to add 45 minutes to an hour to the day that you have chemo if you do it all in the same day.
Okay. So how long is the actual chemo process?
The adriamycin and Cytoxan, once you actually get back to the chemo area and you get hooked up, is about 3 hours. Yeah. Okay. So you're here 3 to 4 hours already, so that does tack on an extra 45 minutes to an hour. Now, some people, they come from 45 minutes or an hour away. It's not feasible for them to come the day before, and we can't do it any earlier than the day before. But if that works better for you, we definitely will do that for you. We have a lot of people that do it that way too.
Because doing the lab work before, that will make it a 3-day process as opposed to a 2-day process.
Because then I have to do lab work, do the chemo, and then have to come for the shot, right?
Now, the lab work appointment is not going to be a long appointment. So, for instance, are you in school or working right now?
No, but I hope to be soon teaching again.
Okay.
So that's what I was worried about.
Okay. You would get out about 3:30, right? So we could make you like a 3:45 lab appointment. In a couple of days, you may have to leave on lab day 20 minutes early, but you could get lab at 3:45 and then come the next day for treatment.
I'm worried about treatment days because that's the longest one.
Yeah, treatment days are the longest. But you won't be back in school while we're giving you adriamycin and Cytoxan.
Oh, okay, because then the second part is different.
The second part is going to be Taxol. That's once a week.
Okay.
And those treatments are probably 2 hours, not as long.
Okay, that's not as bad.
Yeah, and you won't have to have the shots.
Okay.
For the second part. You only have to have the shots for the first part. So, yes, you would be right. The first part would be lab on one day, chemo the next day, and shot the next day.
But that's not too bad. Okay,
right,
so I'm not worried about that.
You won't be back in school then.
Yeah.
And once you get back in school, we'll be in
the second phase of the treatment. Probably.
Yeah. Do you mind if I check my calendar for something?
No problem.
Just get a time frame, okay? Just so you have an idea. So you're ready to start chemotherapy. So let's just say we start next week. Let's just say June 1st. Just to make it easy.
Let's
okay.
Make it easy.
So it would be June 1st, then June 15th, June 29th, and July 13th. Okay, so those would be those 4. So we're in the middle of July already. Then 2 weeks later, we're going to start Taxol. So Taxol would start like July 27th-ish, last week of July. Okay, and that would go through 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, middle of October.
Okay.
Okay, but you don't have to get any shots after. And it is once a week. And if you start adriamycin and Cytoxan, let's say you start on Mondays, all 4 of your first 4 treatments are going to be on a Monday. But then when you go back to school and you get your schedule, and you say, Kathy, Thursday's going to be my best day. Okay. I need to come Thursday, like around noon, because I need to work half a day. Okay. Then we'll shift you to Thursday for those.
And you don't have anything on Saturdays, right?
No chemo on Saturday. I'm sorry. Okay.
I said I ask.
That's all you can do is ask, right? But I do think that we can get the Taxol once you go back to school, and if you're working, we can get the Taxol for those, first 7-8 weeks of school late enough, 12:30. We'll work with you so that maybe you can work half a day and only have to take half days off.
Okay.
Okay, so that's just looking down the road at possibilities. Is that helpful?
Yeah.
Okay, so now we kind of have a time frame. You're looking at mid-October to be finished with this part, and then there's radiation therapy. That's a whole separate ball of wax, so.
Yeah.
Okay. So let's go over here. The last statement under warnings while using this medicine says your doctor will do lab tests at regular visits to check on the effects of this medicine, so keep all your appointments. Possible side effects, and keep in mind that all these things I'm going over are just possibilities. It doesn't mean all these things are going to happen to you. It can sound really scary, okay? But some things, you're going to be tired. Yeah, you're probably going to be nauseous, okay? But I've got people that go through this treatment, and they're great. Some people have a really hard time, and we don't know how it's going to affect you. But I don't want you to think every single thing on this paper is going to happen to you, okay? So possible side effects. I need you to call me right away if you get any of these. And again, I have a separate handout, and it kind of puts all this on one sheet of paper, okay? If you have an allergic reaction, and that's going to be itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing. If you have any chest pain, a fast pounding or uneven heartbeat, fever, chills, cough, real sore throat or body aches, rapid weight gain, swelling in your hands, ankles, or feet, trouble breathing, or tiredness. Now, you're going to be tired, but this is going to be extreme fatigue. You go to bed at night and those pants fit you, and you wake up the next day and you can't button them. Wow. Your ankles look like elephant ankles. That's the kind of rapid weight gain we're talking about. Okay. If you've got severe nausea, severe mouth sores, diarrhea, or uncontrollable vomiting, you can't eat, you can't drink, you can't do anything, okay? Then if you have any unusual bleeding, bruising, or weakness, you're bruising all over, your gums are bleeding, okay, then we have to think, we might need to check your platelets, okay?
And I did talk with my dentist about this too.
Okay.
She gave me some good stuff.
Good. If you notice these less serious side effects, she can just give us a call or talk with us when she comes in for treatment. Changes in your menstrual periods, that does happen. A lot of people just don't have periods for quite a while they're on treatment, okay? Not everybody, but some people. If you get hair loss, you're going to lose your hair. Adriamycin makes you lose your hair. I hate to say it, but it's just the truth. If you've got mild nausea, vomiting, diarrhea, or mouth sores, it's not so bad. She can eat and she can drink. It comes and goes. Now, with this adriamycin, your urine could be red for 1 to 2 days after treatment. When you see them give you this medicine, it's like comes in a giant syringe, and it looks like, for lack of a better descriptor, red Kool-Aid. It's bright red. So it just makes sense that it goes in bright red, and as your body metabolizes it, it could have a reddish tint to your urine, but that's going to be 1 to 2 days right after treatment. Okay?
So if it's anything after that.
If it's 5 days later, it's not that. Okay? Then it's something different. Okay? Questions about this, the adriamycin?
No.
Okay.
All right, guys. I'm going to come back with part 2 later.